Hi, my name is Caitlin Caplet. This is Brian Smith. Brian, do you consent to this NU 650 head to toe exam?
Yes.
All right, I'm going to start by washing my hands and performing some hand hygiene. Then I'm inspecting his skin. I'm looking at the moisture, the color, any discoloration, lesions. Good. And then I'm inspecting his head for any patterns of hair loss, lesions, lumps, deformities, or tenderness. Any tenderness?
No.
Good. And then I'm inspecting his face for symmetry. Good. And moving on to his eyes, I'm inspecting the external eyes in the conjunctiva, the sclera, the color, as well as the size of the pupils. Good. I'm now going to check pupillary restriction and good. Pupils are responsive, direct, and to consensual. Now I want you to look at this pen and keep looking at it. Good. And then look at the wall that's straight in front of you. Good. Accommodation. Now we're going to move into cranial nerve 2, visual acuity. I want you to cover one eye and read the smallest line you can.
LTFPH.
Good. And the other eye.
LTFPH.
Good. Now I'm going to test confrontation. I want you to tell me when you see my finger wiggling while you stare at my nose.
Wiggling. 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 Wiggling.
Good. I now want you to follow my finger with your eyes. I'm testing the 6 cardinal movements. Good. I'm now going to visualize some of the internal eye structures using the ophthalmoscope. I'm coming in at a 20-degree angle. Good. I visualize the red reflex, so I'm moving in closer as well as dialing in to see the retina, the optic disc, the vessels and vasculature, and no papilledema was present. All right, I'm now going to move on to the ears. I'm starting by inspecting the external ear and auricle for any deformities, lesions, any tenderness.
No.
Good. I'm now going to switch to the otoscope. Go ahead and take a little step. Can you move forward a little bit? Thank you. I'm inspecting. I'm pulling the auricle upward and backwards and inspecting the ear canal. Minor amount of cerium present. No redness, lesions present. And I visualize the tympanic membrane, which is pearly gray. And I also visualize structures as well as the cone of light. Good. I now want you to put your thumb in your ear and rub it. Yep. And I want you to tell me the 2-syllable word I'm going to say.
Blueberry.
Good. And for time purpose, I'm only going to do the assessment on this ear and this eye, but I would perform it on both sides. Okay, moving into the nose on inspection, there is no lesions, perforations, or deviation. I'm going to occlude one nostril, take a deep breath in. Good. Take a deep breath in. Good. No obstructions noted. I'm now going to examine the internal nares. Good. No ulcers, septum deviation. or boggy pill membranes present. I'm now going to palpate the frontal and maxillary sinuses. Any pain or tenderness?
No.
Good. Moving on to the mouth. The external lips are pink, no lesions or ulcers present. They're moist. I'm now going to use the tongue depressor and otoscope to examine the internal. Open for me. Good, just keep your tongue in. Good, the mucous membranes are pink and intact with no ulcers present. All teeth are in place with no decays or caries. Stick out your tongue and open wide for me. Good, I'm now assessing the tongue. It is pink. The roof of the bottom of the mouth has no ulcers present. And go, ah, for me. Good, I'm visualizing the posterior phalanx. The uvula is midline and rises upward. The tonsils are both present with no exudate present. Good, now stick out your tongue and move it side to side. Good, and relax. Good. I'm now going to move on to the jaw. I'm palpating the masseters and temporalis. Now clench your teeth for me. Good, the masseter muscle is slightly bulging. Good, and I want you to move your jaw forward for me and then side to side. Minor clicking noted, which could be indicated of TMJ. Okay, I'm now moving on to the neck. On inspection, there is no lumps or lesions present, no JVD distension or carotid pulsations. I am now going to palpate the lymph nodes, starting with the preauricular, the posterior auricular, the occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, good, and deep clavicle. Good, I'm now palpating the trachea. It is midline with no deviation. And the thyroid, I am palpating. Swallow for me. Good, no nodules or deviations. Belt. I now want you to turn your head towards the side. Good, and the other side. Good, now shrug your shoulders up for me. Good, and relax. Good, we're now going to test the neck range of motion. Put your chin to your chest. Good, and now backwards. Good, look to the side and the other side. And then bend your ear to your shoulder and your ear to the other shoulder. Good. We're now going to move on to the anterior and posterior upper thorax. So on inspection, his respiratory rate and rhythm is normal. No use of accessory muscles or retractions noted. No visible pulsations or thrills. All right, I'm going to start by palpating the anterior and posterior chest for any heaves or thrills. Good. I'm now going to palpate for the point of maximal impulse, or the PMI. Good, it is at the 5th intercostal space. And on the posterior, I'm going to palpate for any crepitus or fremitus. Say 99 for me.
99.
Good.
99. 99. 99. 99. 99. 99. 99.
Good. Okay, none is present. I'm now going to move into percussion. Can you, actually, you can stay right here. I'm going to start by percussing the posterior. Can you turn to the side just a little bit? Good, perfect. Good. I'm hearing resonance. I'm now going to percuss for diaphragmatic exertion. Take a deep breath out and hold your breath out. Good. And now take a deep breath in and hold your breath in. Good. And the width is about 3 to 5 centimeters. And relax. Good. I'm now going to move into auscultation. Actually, briefly before I move into that, I'm going to inspect and palpate his carotid pulse, noting amplitude. Good. And I'm also going to palpate his radial and his brachial. Good. All right, I'm now moving into auscultation. I'm going to start by listening to his carotid pulse or his carotid for any bruise, and then I'm going to move into auscultating his anterior chest at the aortic, the pulmonary, the Erb's point, tricuspid point, and mitral point. I'm going to be auscultating first with my diaphragm and then second with my bell and listening for any murmurs, any bruise, any the S1, S2, noting any S3 or S4 additional heart sounds, any abnormalities in rhythm, rate, etc. Good. No murmurs were present. I'm going to auscultate both the anterior and posterior lung fields for any adventitious breath sounds. Deep breath in. Good, and I'm hearing vesicular breath sounds throughout. All right, we're now going to move into the upper extremities. And I'm first inspecting the skin in the arms, the muscles, noting any atrophy, any lesions. The skin is warm to the touch in pink, no discoloration. The fingers have no clubbing or cyanosis. Good. Now I want you with your hands to make a fist. Good. Now open it up wide and make a fist again. Good. Now I want you to touch each thumb to your finger. Perfect. Good. All right. Now moving into your wrists, I want you to point to the ground. Now point up to the ceiling Now turn your hands inward and outward. Good. Now moving into some strength tests. I want you to spread your fingers wide, and I don't want you to let me push these fingers inward. Resist me. Good. Now grip onto my fingers and don't let go. Good. Now hold your wrist out like this. Don't let me push your hands down. Good. All right, moving into your elbow. I'm inspecting it. No effusion or deformities noted. Any tenderness?
No.
I want you to flex your arm like this. Straighten it out. Turn your hand this way and this way. Good. Now I want you to resist me pulling your arm in. Good. Now flex your arm and resist me pulling you out. Good. Now moving into the shoulder. I'm inspecting the shoulder as well as the scapula and posterior back muscles for any atrophy or abnormalities. They look good. All right, now I want you to raise your arm out in front of you and overhead. Good. Now raise it out back behind you. Good. Now raise it out to the side and overhead. Good. And now in front and to the side like this. Good. Now touch your head like that and like this. Good. And you can relax. And I would repeat that on the other side, but for time's sake, we are going to move on. All right, we're now moving on to the abdomen. I want you to lay back and bend your knees for me. All right, I'm starting with inspecting. The abdomen is symmetrical and concave, no distension, no pulsations are visible. I'm now going to move into auscultation. I'm first going to listen in all 4 quadrants, and then I'm going to listen over the renal, the aortic, the iliac and femoral arteries for any bruits, as well as the liver and spleen for any venous hums or friction rubs. Right? Vowel sounds are normal and audible with the frequency of between 5 and 35, and no bruits, friction rubs, or hums were heard. I'm now going to move into percussion. I'm noting tympany throughout with some dullness at the liver's base. Good. I'm now moving into palpation. I'm first going to start by palpating lightly throughout for any tenderness or guarding. Does that hurt at all?
No.
Good. I'm now going to try to palpate the aorta and estimate its width. Good. And it is about 2 centimeters in diameter. Good. I'm now going to do some deep palpation, trying to palpate any deep organs or borders, such as the liver's border, the spleen's border, or kidneys, as well as noting any tenderness or pain, especially in the right lower quadrant. Any pain or tenderness?
No.
Good. All right, I'm now going to palpate the inguinal lymph nodes. Good. And I want you to sit up for me. And I am going to test for any CVA tenderness. Any pain?
No.
Any pain?
No.
All right, I am now inspecting the back and the spine for curvature, any abnormalities in symmetry or concave, as well as any masses. It looks good. All right, I'm now going to inspect the lower extremities. Lay back for me. I'm inspecting for size and symmetry and musculature, as well as the skin temperature, any patterns of hair loss, any vascularity abnormalities or venous insufficiency. They are warm and pink to the touch. I'm going to take off his socks and look at his feet for any cyanosis. Good, the feet look good. All right, I am now going to palpate his femoral, his popliteal, his posterior tibial, and dorsalis pedis pulses. Can you scooch back for me a little bit? Good. Good. And I only did this on one side for time's sake, but I would repeat all of these assessments on the other side. All right, you can go ahead and sit up for me. All right, I'm going to actually have you stand up now. And I want you to bend over and touch your toes for me. Good, and stand up. Good, I want you to try to extend your back backwards a little bit. Good, bend side to side. Good, and then turn and rotate side to side. Good. And moving upwards back into the neck, I want you to touch your chin to your chest. Good, look backwards. Look to one side, the other side, ear to shoulder. Good, ear to other shoulder. All right, good. Now we're moving into the hips. I want you to lay back on the bed for me. And hug your knee and pull it to your belly. Yep. Good. Now I want you to roll to your stomach and extend your leg out backwards. And up. And lift it off the bed. Yep. Good. And relax and roll back onto your back for me. But I want you to just move your leg out midline. Like that. Good. And now do it yourself. Good. And back together. Relax. Now I want you to bend your knee and rotate your leg past midline. Good. Now with your knee bent, I want you to rotate your leg out. Good. And then in. Good. You can. I want you now to just bend your knee for me. Good. I'm assessing for the knee for any effusion, any bulge, ballottement, or balloon signs, which are negative. Any tenderness?
No.
All right, I now want you to sit up at the edge of the bed. A little bit further. Yep. I want you to straighten your leg out and then bend it. Good. I now want you to bring your leg inward. Yeah. And then outward. Good. And relax. Now moving in to the ankle, I want you to point your toes downward. Good. Pull them backwards. Good. Turn your heels outward. Yep. Good. And relax. Good. We're now going to move into some strength tests. I want you to stay where you are. Lift your leg up for me and back down. And I want you to push down on my hand as hard as you can. Good. Now don't let me pull your leg upward. Good. And relax. Now don't let me push your legs apart. And don't let me push them in. Good. Don't let me straighten your leg. Good. Now straighten your leg. Don't let me bend it. Good. Relax. Don't let me push your toes down. Good. And now pull up on my hand. Good. And relax. We're now going to test some coordination. I want you to touch your finger to your nose. Yep, perfect. Other side. Good. Now I want you to take your heel and run it down your shin. Good. Now stand up for me. I want you to just take a few steps forward, walking normally. I'm assessing his gait for any abnormalities. Now I want you to walk back towards me, heel to toe. Good. Now hop in place for me. Good. And sit on the bed. And without using your hands, stand back up. Good. Now close your eyes for me. And keep your arms to your side. I'm now performing the Romberg test. I would have him stand like this for 60 seconds, but for time's sake, I'm going to move on to the pronator. I'm testing for a pronator drift. Open your eyes for me. Put your arms out in front of you. With your arms up. Yep. Close your eyes. Good. And same here. I would be noting any drift in the arm. Okay, you can relax. I am now going to test some reflexes. I'm going to start by doing, relax like this, good. The brachial reflex. Good. Now I'm going to test the triceps. Good. In the brachioradialis. Good. Now the knee jerk, sit down for me. Good. And the Achilles. Good. Now, lastly, I'm going to test some sensory. I want you to close your eyes for me. Tell me if this is sharp or soft.
Sharp. Soft.
Good. I want you to tell me if this is 2 points or 1 point.
1, 2.
Good.
1, 2.
Good. I would now also test vibration by striking a tuning fork on his ankle and seeing if he could feel that vibration. Moving on, I want you to close your eyes again. Hold your hand out. Oh, just like this. Tell me what the object in your hand is.
Key.
Good. And I now want you to close your eyes again. Tell me where I'm touching you.
Left arm.
Good.
Right calf. Right side of face.
Am I touching one side or both?
Both. Both. 1. 1. Both.
Good. Uncross your legs for me. Good. And let me see your hands. I want you to close your eyes. Tell me if I'm pointing your finger up or down.
Up. Down.
Good. And hold out your hand. Tell me the number I'm writing on your hand.
8.
Good. And that concludes our exam.